Hey everybody, when is surgery the right option for those that have hallux rigidus? It's something that's really important to consider, and making sure that we're not jumping straight for it is something that, can be controversial because, when we've got joint degeneration like this, we want to make sure our patient's comfortable. And, a lot of the conservative options that I've talked about in other sessions are fantastic, can prolong the time until surgery, but definitely may not reduce all of the pain completely. And that's where we start talking about that ongoing pain, even though we've done a lot of conservative treatments, a lot of conservative interventions that have been trialled. Some of the time we may find that there is worsening pain, or the x-rays indicate progression. And typically for this type of concern, I like to see them before they get to this stage, because at this stage I'm often needing to fuse the joint, but there's lesser procedures that we can do when it starts becoming painful and we're seeing some of those x-rays identify degeneration of the joint and osteoarthritis of the joint. And so that's where we can start putting less invasive, quicker recovery procedures into place. So as it's progressing, we definitely want to consider whether a surgery might be better earlier on than later. Particularly if our patients are unable to wear shoes, that's a red flag for me to say, okay, we need to start thinking about, if they've done all their conservative interventions, they're still unable to wear shoes, that's where I want to be talking to that patient about their options for advanced conservative, whether that's injection therapy or potentially through to our surgical options. If there's any callus or rubbing or particularly wounds due to any of the osteophytes around the joint, I'm again very concerned, and it's something that we can really manage quite effectively to reduce some of what's going on there. And if our patients are unable to undertake their activities of daily living, so this is getting out of bed, showering themselves, being able to prepare and cook meals, any of those sort of concerns, or it's significantly impacting their life, their work, their social activities, that's where procedures are potentially a good option to look at this stage, so that we don't have that progressing to a point where they're then unable to undertake any of their activities of daily living. Hopefully this has given you a little bit of a further idea of when surgery is the right option for hallux rigidus. In the meantime, hit subscribe, look at some of our other videos, and hopefully we'll see you in the next session. Cheers.